By the early 1800s, there was an increasing interest in mental health, and Charles William Wynne established an inquiry into the conditions of the pauper lunatics, to use the language of the time, in 1807. The report found terrible conditions in the workhouses and recommended that magistrates set up county asylums across the country.
The Mendip Hospital started out life as the Somerset and Bath Pauper Lunatic Asylum, and it opened in 1848. The place when it was built was for less than 400 people, but it expanded.
It became an almost self-sufficient community, with residents producing beer, shoes and clothing as part of the therapy.
They had pigs, they had cows, they grew crops. Diet was really good. It was much better than they got in the workhouse, it really was. It's a myth that the Victorian asylum was a place of horror. The reason the county asylums were established was to stop that sort of practice.
Dr. Robert Boyd, the first superintendent, advocated good nutrition and relief from the stress of poverty as an important part of the healing.
And so it was really like a village community. They had their own land, the patients farmed it. But like a village, you're going to have people dying. So what do you do with them? And in 1874, the cemetery opened. And this chapel was built it was opened, first used in 1880. In 1948, the NHS took over the hospital. The last burial took place in December 1962. And I think what probably happened, they thought, well, if we close the cemetery, we won't have to pay to maintain it. Now, it could be at this time when the grave markers were taken up. But in the 1980s, they had plans to turn the chapel into a scientific study area for schools. They reluctantly left, and for the next 15 years it went totally wild again. And then in the year 2000, it was a local farmer who approached the NHS because he wanted to buy it because he thought it would be good to develop for houses, because the houses had been built all around it. But whatever happened, it was put up for sale. And Heathcote Amery, the MP, raised the matter in the House of Commons. After a while, they put a halt to the sale, but then discussions went on after that for a couple of years, and it was the people that held the meetings to save the cemetery. The Friends of Mendip Hospital Cemetery came from there. In the year 2002, we were granted a 999-year lease. But people love to come here to learn about the history of mental health, because this is what we are doing. So we've got names of all the people that are buried here. We do get a lot of people have found their ancestors here. But we've got nearly 3,000 people here who had lives. They came from families, they might have had families. The vast majority had jobs. We've got people who are mentally ill, but we would now say they've got schizophrenia or bipolar or what have you. It's all sorts of conditions that hadn't really, they knew very little about mental illness. Remember, these people were lost and forgotten. They haven't got gravestones. And the attitude to mental illness in the past was a lot different to what it is now.
We do currently have mental health services in Wells, but unfortunately over time they are diminishing. So we did have Phoenix Ward that got closed, and at the moment there is St Andrew's Ward, which is based down near the Bridge, which is the local mental health team on the same site as the doctor's surgeries. They closed Phoenix Ward. St Andrew's, the Somerset clinical commissioning group actually decided to close St Andrews back in 2020, but because of the circumstances of COVID and the increased requirements for mental health at that time, it's kind of been delayed, and there is a lot of people that are wanting to obviously not see the services disappear. The reason it was chosen to close was because Wells is about 45 minutes from any major A&E provision. So they were looking to move the 14 beds, which is at St Andrews currently, to Yeovil, which would then mean the bridge with the mental health team that we've currently got is probably quite vulnerable because they haven't got the support services around them. I'm the operations manager at Heads Up, which is a local mental health charity on the outskirts of Wales in South Horrington. We're a day service that provides mental health support. It was set up with very little funding and help from the community, and initially we supported only about 4 or 5 clients a week. We support about 70 people a week now. We also provide an outreach support service, so we go out into the community, help people to access community resources, attend appointments, budgeting, cooking, that sort of thing. We do an awful lot of work around carers as well. Sometimes mental health can be quite isolating. Our clients that come to us, although they like doing their own individual projects, it's really nice to do a collaborative piece. It gives people the opportunity to have shared experiences, to feel part of the community.
We work with 2 artists, Sally Dempsey and Jade Ogden, and we explored the collections here at the museum with them, and they came up with ideas for objects, photographs and all sorts of things that they thought might inspire the people that they were going to be working with in the art groups.
We're really interested in some of the collections here at the museum, and we started off by gathering some of the items to go in handling boxes, which we could then take to Heads Up to kind of inspire the artwork directly from the collections.
And there were 3 areas they were particularly inspired by. One was the various vessels and pots that we have in the Bolsh room, and these are sort of Iron Age drinking vessels, storage vessels. They found those very appealing.
We had a few different processes on the project. We were focusing on printmaking and also dyeing, and then Sally was focusing on ceramics.
Each week they started with a cup of tea, different teas we used each week, and the dregs of those teas and those tea bags we used as stains and colours to start using in some of the work that was produced.
Art is a huge part of Heads Up. That sort of creative activities that we put on quite regularly throughout the week for the various different clients that we support.
Kind of engaging with different parts of the community, so working at Heads Up with people with mental health conditions and learning disabilities and dementia.
What we really wanted to do is work with artists to actually bring out the value of those museum objects as inspiration for creativity.
The piece was first shown at Wells Art Contemporary, which is in Wells Cathedral. I think that was really important to everyone that took part. It's really special, I think, to be able to share that platform, making these spaces accessible for them and giving people confidence to do more of their own work. I think that's important.